All right, meanwhile, California lawmakers recently approving a bill to punish doctors who spread what they call false information about COVID vaccines and treatments. The legislation would not require suspension or revocation of a doctor's license, instead leaving it up to the state's medical board. Governor Gavin Newsom and his handsome hair has until the end of the month to sign this into law or to veto it. The legislation has raised concerns over freedom of speech. The big question, who determines truth and falsehood? Joining me now in studio, certified internist and host of the Ask Dr. Drew podcast, Dr. Drew Pinsky is back. This is crazy town. This is troubling. And when it first came out, I went to wild on Twitter on it. And the president of the Board of Medical Quality Assurance responded to me, got on the phone with me, reassured me, and I felt better about it. A couple things I learned. One was that she said they already have this authority. I was like, great. And then I woke up the next day in a cold sweat thinking, okay, this woman is reasonable. Her dad was a doctor. She's a lawyer. But when she's gone, who knows what someone could do with this law? It is essentially saying if you divert from the standard of care, so-called, and you talk to your patient about that issue outside of the standard of care, such as, hey, if you go home with 90 Vicodin, that's not a good idea. That was the standard of care for years in the 90s. Or when I arrived at the psychiatric hospital where I started working for many years, I acquired about 24 patients that were the object of the standard of care of the 40s and 50s, where they put a pick up here and swiped it back and forth and did frontal lobotomies. Disasters. Standard of care changes. And doctors are responsible to discuss all of that with their patients. So if I take an 18-year-old or a 19-year-old and I say, hey, CDC says 12 and above gets vaccinated, but there's a signal around myocarditis we're concerned about. We're not sure on the data on that yet. The incidence of serious illness from COVID, you're a healthy person, probably not a big deal. Moderna, I'm not so sure you should be taking that because of this signal. All that outside of the standard of care. So I literally can't do informed consent even with a patient, given today's standard of care. Okay, but doctors disagree about things.
The standard of care, absolutely. Look at what the pandemic has been like. It has not taught everybody that. Not only do we disagree about things, but it's a moving target. Clinical medicine is a moving target. Now, the president of the Board of Medical Quality Assurance assured me they would take that all into account. It was only major outliers. They don't take action. I felt better talking to her. But why do they need this law if they have it already, number one?
To beat you into submission.
And
to bully physicians they don't like to make sure they get back to a correct way of thinking.
And listen, all of us as physicians have had to respond to the board. You have to hire an attorney. It takes weeks. It's hundreds of hours of work and citations and defense of your position. People can do it anonymously. They can do it as many times as they want. They can literally destroy your practice just with complaints if they get...
Where's the due process there?
Oh, it's all due process, but what comes to the board is dealt with as though it's a criminal charge. And each charge has a due process.
Who would want to be a doctor in California?
Absolutely. People are going to leave. And who would want to be in primary care, especially the way they treat primary care doctors now? It's just really unconscionable. So, again, I want to thank you to the president of the board who spent her time talking to me on a Sunday. I appreciated that. But I worry about when she's gone and somebody else comes in, this thing could be...
Well, I know you've already had a lot of stuff taken down on YouTube.
I have been in YouTube jail a couple times. Yes. I've been in multiple strikes. That's another outlet where we had to call. We got a human being, we get reinstated. This is the problem. These are bureaucratic nightmares for people that if they don't have the energy or the time or the resources to respond to them, it could be devastation.
Yes, and you pay with your career and your reputation.
100%.
Guess what? We need good people in medicine.
What?
We need more of them.
You're kidding.
This disincentivizes that.
There are so many disincentives to primary care now. It's breathtaking. It's breathtaking.
Is the pandemic over? The president said it was last week.
I think what he said, very casually, was exactly correct. Mm-hmm. The problem is now there's unraveling of a lot of bureaucratic entanglement that he's got to do. I didn't realize also some Medicaid access may be undone too by him saying that, which was kind of news to me.
Yes.
But there's a lot of things that need to come with that acknowledgement.
Oh, hey, let's take the whole house of cards down because there's way too much medical surveillance.
But don't worry, in California it will remain an emergency. Trust me, it will stay an emergency in California.
And Germany.
Yeah, that's right.
Dr. Drew, good to talk to you. Thank you so much.